Staghorn stone is by far one of the most dangerous types of stone out of the stones, that different type of stones we have. We have the calcium stone, the struvite stone, the cystine stone, and uric acid stone. But when you are diagnosed with um, staghorn stones, it calls for concern. The reason why it actually calls for concern is that staghorn stone, as the name implies, is a kind of stone that have horns, okay, that has formed branches that makes it look like a horn. That's why I have staghorn stones. So it's actually one of the most dangerous types of stone that anyone can have. This is because staghorn stones usually found in the pelvis, although it can happen to any other part of this, and they grow rapidly. And by the time they grow rapidly, they have the tendency of blocking the flow of urine, causing massive obstruction. And they can also branch into the calyces, okay, making it very difficult for urine to flow, leading to hydronephrosis. And when hydronephrosis occurs, it actually leads to um, kidney infection. Okay, this person starts battling with repeated attack of kidney infection, and by so doing, there's rapid loss of kidney function, and this person may actually end up having a damaged kidney. A lot of people who have staghorn stones that are not properly detected on time or not properly handled face a lot of difficulties um, um, in face a lot of issues with their declining kidney function. This is how to detect staghorn stones. Staghorn stones, just like every other stone, have same signs and symptoms: lower back pain, um, fever, and all the rest of them. But if you are the type of person that usually have infection, urinary tract infection, you've been treating urinary tract infection off and on, it means that the kind of stone that you may be having is actually a staghorn stone. But the truth is that you may not really use signs and symptoms to know that you have a staghorn stone until you go for test. So which type of test do you need to go? A test as little as ultrasound scan, abdominal ultrasound scan can actually help you dictate if what you're having is actually a staghorn stone or not. Okay, but then you also need to do more comprehensive investigation to know what you're having is staghorn stone or not. So how will your sonographer know that what you're actually passing through is staghorn stones? What they are going to do is just to look at the appearance of the stone. Some stones appear roundish. Some when they now see stones that have branches, they will not tell you that this is staghorn stones. But the truth is that some people who are not knowledgeable about ultrasound scan, especially when it has to do with kidney ultrasound and noting kidney stones and all the rest of them, they may classify it as multiple stones. Okay, they'll not tell you that you have 2 cm here, 3 cm here. Meanwhile, it's one stone. So by the time you notice all these things, I advise anyone who has kidney stone, it's actually good for you to actually do a CT scan, no matter how expensive it is, at least once in your treatment. Once you've detected it and you've done treatment for a while and it's not going, there's need for you to do a CT scan. And advise people, especially if the stone you're having is above 10 mm, okay, and you have multiple of it. So this CT scan is actually going to be um, the chief judge, let me use that word, in this very case, that will not tell you that this is actually what you have. The reason why kidney CT scan and ultrasound scan will be able to tell you that what you're having is staghorn stones is because of the shape of the stone. Okay, the truth remains that every other type of stone may not really be identified by CT that this is calcium stone, this is struvite stone, this is uric acid stone, until the person passes the stone or the person operates the stone and bring it out, and this stone is taken to the lab for a procedure known as stone analysis. So without that, you will not really be able to know that this is this or that. Okay, but someone who is actually knowledgeable about stones can, with good history taking and good consultation, tell you that this is the type of stone that this person is having. So now, one of the things that you're going to be taking out from this video is that staghorn stones are very dangerous, okay, because they grow rapidly and they tend to block. They grow rapidly and they tend to block the flow of urine, leading to very serious and severe complications. Okay, so another thing that you also need to also know about staghorn stone is that staghorn stone is not just a standalone stone. Okay, that is why when you're talking about the different types of kidney stones, most time people don't mention it. Most calcium stones are formed by struvite stones. What's struvite stones? Struvite stones are the kind of stones that occur due to um, um, repeated attack of urinary tract infection. So when someone is having repeated attack of urinary tract infection, they are prone to developing stagon, sorry, Struve stone. So this Struve stone, when can actually now, if not properly handled, if not properly treated, can now begin to widen. They are the ones who have the ability to form stagon stones. They now begin to form branches one after the other. So if you have kidney stones and you need to you're just running into our video, we have a lot of materials in this YouTube channel that can actually help you to diagnose and handle kidney stone properly. But if you need us to help you look at it one-on-one, okay, you can send I'm interested in the comment section, and I'll be sending you link that you can use in reaching me directly. So we'll talk one-on-one about how you can actually manage kidney stone successfully. We have a class where we talk to people about kidney stone, and we have helped a lot of persons pass kidney stones successfully. If you go through this YouTube channel, you see so many amazing testimonies, and I believe that you're the next in line. I'm Honorable Victory. I'm your kidney health coach. I'm here to make sure you have a healthy kidney. Stay blessed.